You pretty much have a 100% chance of having low back pain at some point in your life. But did you know that 28% of people suffer with chronic low back pain for longer than 3 months? So today, that's what we're going to talk about, is what is causing your low back pain so you don't have to be part of that 28%. For those 28% of people who suffer with chronic low back pain, it really affects their quality of life. It keeps them from doing activities that they would like to do and interacting with their friends and family how they would like to. For some people, it keeps them from being able to do the jobs that they want to do. And it definitely keeps you from being able to enjoy your life because you find yourself limiting your activities because you suffer with so much pain. So first, we're going to conquer some common myths regarding low back pain, and then we're going to talk about the different structures that could be causing your pain and how to know if that's what's bothering you. Myth number 1, if my back hurts, I should take it easy until the pain goes away. You most likely shouldn't take it easy for more than 24 to 48 hours. Now, if you have an injury and you're unable to move correctly, then yes, you do need to take it easy for maybe 24 to 72 hours, but then you need to get back to moving as much as you can pain-free. This may involve walking, it may involve just being able to do things around the house like normal daily activities, but you don't want to be laying in bed for a week or two because I guarantee you, your low back pain is going to get worse if you lay in bed for a week or two. Myth number 2, I have a slipped disc, I must have surgery. And you could say a herniated disc, a ruptured disc, any kind of disc injury, and therefore I must have surgery. This one is particularly difficult for me because I have actually observed surgeries with people who had a ruptured disc. It was on MRI, they saw the ruptured disc. And then when the surgeon went in there 3 weeks later, he was unable to find the ruptured material. You see, your body is able to heal itself. And this patient who I'm talking about obviously had healed on their own because they no longer had the ruptured discal material. The body had actually dealt with it and reabsorbed it. So you don't necessarily need surgery just because you've been diagnosed with a slipped, ruptured, or herniated disc. Myth number 3, the more pain I have, the more damage I have. There's not necessarily a correlation between any imaging results you may have and the pain that you're suffering with. Because the thing is, there's many things that don't show up on MRI that actually may be extremely painful, but won't be seen on any form of imaging. Myth number 4, everyone with low back pain should have an MRI. This is a common misconception, and many people often get frustrated when they go to see the doctor and they do not order an MRI for their low back pain. Instead, most commonly, they'll send them to PT first. And the thing is, what we have found over 40 years of having MRIs as part of our life is that the MRI results do not necessarily correlate with what is going on with the patient. Therefore, the doctor wants to see, can the patient heal their body naturally with help from a professional like a specialist physical therapist before they do any imaging? Because remember, imaging can give us a lot of information, but it's not necessarily great for our bodies. Which leads to myth number 5, X-rays and MRI can always show exactly what's going on with my body, which leads us into what is actually causing your pain. Because there are a lot of structures that, although they will show up on the MRI, the dysfunction that they have will not. So, what is causing your low back pain? The first thing we're going to talk about is a muscle strain. So this is when the muscle gets irritated, it may get tight, it may be injured, and this is what's actually causing your pain. Now, often if you have a muscle injury or stress to the muscle or tension in the muscle, this is not the only thing causing your pain, because when the muscle gets tight, it puts pressure on the discs and on the nerves and on the ligaments and everything else. So the muscle strain may be what caused the problem in the first place, but you may have other structures that are involved in this as well. Now, how to know if this is you is usually people who are suffering with a muscle strain can put their hands literally on the problem. They can feel their low back and feel around and be like, oh yes, that's the point where I'm actually having the pain. So if you can put a finger on the pain, chances are good that it's a muscle strain that at least started this problem. The second thing we're going to discuss is a ligament strain. We have ligaments all throughout our body, honestly, but all throughout our lumbar spine. And that helps to keep everything moving correctly. And they can easily get strained, especially when we're doing triplanar motions. So triplanar motions are when we have combined motions. So first plane is flexion extension, second plane is side bending, third plane is rotation. So when you bend over in the shower to pick up the soap and you're bending over and also rotating, that can cause a lot of strain, particularly to the ligaments and the disc. So the ligaments can get strained and they're way down deep in there. So a lot of people who are suffering with a ligament strain will actually say, I'm okay most of the time, but I do this one motion and it really is painful. And that can really be a good sign for you to help understand what's going on with you. Now, the important thing is we want to make sure that we get that ligament strain corrected because, again, this is a very delicate area. There's a lot of structures that have to work together. So if that ligament strain goes on for a long time and you just press through with the pain, chances are good that you're going to cause injury to some other structure like your disc or your muscles or even potentially the vertebrae. Now, one thing that can be causing your low back pain is actually a fracture in those vertebrae. So we call those spinal fractures. Now, these are relatively uncommon unless you suffer with osteoporosis or you've had some kind of injury, like a fall or a car accident or something like that. So a lot of people wonder, like, I feel like maybe there's a fracture in there. Chances are good if you're healthy, you've never been diagnosed with osteoporosis, and you haven't recently had a fall or a car accident, chances are good that that's probably not what's going on with you. Again, there are some exceptions. But all of the spinal fractures I have seen have been associated with osteoporosis. Now, here's one key thing to know. I do have some patients who have had osteoporosis for a long time who end up getting imaging, not necessarily for their low back pain, but for something else, maybe to look at some organs or something like that. And they find that there are these spinal fractures that happened a long time ago. And old spinal fractures show up differently on imaging than fresh ones. So the doctors are confident that they're older. They can't necessarily say how old, but that they're older. So you can have a spinal fracture and it can actually be painful, but it can actually resolve relatively on its own. However, if you do suffer with osteoporosis and you've started having low back pain, either after a fall, a car accident, or just from a repetitive task, then I would recommend getting in to see your doctor because you do want to rule that out. Make sure that's not the problem that you're suffering with. Now, the number 4 thing that could be causing your low back pain is a disc problem. You can call it a herniation, a protrusion, a slip disc. There's all kinds of different terms for it. They mean slightly different things, but basically, there's something going on with your disc, and that's what's causing the problem. So usually people who have disc pain have multiple directions that are really, really painful. So it's not just that one motion that tends to occur more with a ligament injury. It's actually several motions, and they'll often explain that they feel unstable. How that shows up in the clinic for me is people will come in and I'll ask them to walk and they'll move in a very robotic type of fashion. Like literally they just look like robots because they can't really rotate or move very well. This is most commonly the sign that I see with a disc problem. So if you've had somebody tell you that you look like you're really stiff when you're walking, or you have noticed that you feel really stiff when you're walking, it could be that you're suffering with a disc problem. The other thing to look for is are there multiple planes of motion, multiple directions that you try to move that increases your symptoms? Now, many of us who are over the age of 20 suffer with arthritis in our spine. You see, the vertebrae have these joints in between them where they talk to each other, and the joints can get arthritis in them. And so if you get arthritis in that joint, it starts to get crunchy. It may start to limit motion over time, and this can cause you to have this low back pain because the arthritis is an inflammatory process. It creates this inflammatory soup. We have all kinds of other things around there, including nerves. It can start to irritate the nerves. You can start getting symptoms that are going down your leg, and it can really progress to become a big issue. And this is why if people have been diagnosed with arthritis in their lumbar spine, I definitely recommend working with a specialist physical therapist because you want to make sure that that does not progress. Now, we cannot treat arthritis that is currently there. It is a bone issue, and there's no way we're going to be able to change that. However, we can keep it from progressing forward. We can make sure that the discs stay healthy, so we decrease that stress onto those joints. We can make sure that the muscles are working correctly so we don't get compression of those joints and keep you upright and mobile for as long as possible. Now, why do I say that most people over the age of 20 have some arthritis in their spine? Well, after the age of 20, we lose direct blood supply to the discs in our spine. And that's true for everybody. So what happens is over time, we start moving abnormally. That abnormal stress can cause arthritis in the joints. It can also cause problems with the disc over time. So if you get an MRI and you're over the age of 20, but definitely over the age of 30, chances are good that they're probably going to find 1, some disc problems, and 2, a little bit of arthritis in your spine, maybe even a lot. And I don't want to sound like an alarmist. However, it is considered a very normal finding in this day and age because as we've had MRIs around for 40 plus years, we've started to realize that actually pretty much everybody over the age of 30 has these symptoms. Everybody over the age of 30 has some arthritis, has some joint issues, has some disc issues, maybe even has some ligament issues. So they've started to become normal in that everybody has it. And this again goes back to the fact of why the MRI may not show what's accurately causing your pain. And the number one thing I see that can cause the arthritis and also the disc issue is postural changes that occur over time. You see, when we're young, we're up, we're active, we're running, we're jumping, we're climbing, we're doing all of those fun things. And then as we get older, we tend to sit more. And a lot of people have desk jobs or jobs that require repetitive motion. And either one can lead to wear and tear if we have an abnormal posture when we're doing those activities. So the postural changes that occur naturally as we age because we don't keep up our activity level like we did when we were younger can put increased stress on the joints, on the disc, on the ligaments, on the muscles, and that can actually be the root cause of all of these issues. And of course, you know me, we're going to talk about the big bad uglies. Obviously, there are disease processes that also cause low back pain. The primary one that I'm seeing in the clinic right now is ankylosing spondylitis. And this is actually a disease process where the vertebrae start to fuse together. So you don't even need to have surgery. The vertebrae are going to fuse together. Now, this is really painful while you're in that fusing process, but even afterwards, it becomes very painful because it puts increased stress on the joints that are moving. So the joints that aren't moving usually become pretty pain-free, but the joints now above them have too much stress on them, so then they start to become painful. And often with ankylosing spondylitis, it'll start at the sacrum or the base of your spine and work its way up your spine. Now, this is a disease process, so you need to be working with a medical doctor to find the best treatment options for you. Again, working with a physical therapist who understands ankylosing spondylitis will be super helpful in managing your symptoms and decreasing your pain and keeping you as flexible and mobile as is reasonable based on your spine. Understanding the root cause of your low back pain helps you to know exactly what it is that you should do about it. And it is really important to be able to have some ideas that you can implement right now. Now, you may still need to go see a doctor, and I definitely recommend going to see a specialist physical therapist because they can help you determine what your symptoms are and understand, because chances are good that you're probably suffering with more than one of these issues on your own. Because chances are good, if you have that chronic low back pain and you're one of the 28%, that you don't just have one of these issues, you probably have all of them working together. But you need to understand which one started the problem and how it's affected all of its friends. Because when you understand that, then you know how to unravel those symptoms in order to decrease your pain.